It makes me feel like I'm not a burden because I've always done everything myself. And here, nobody had to come and get me or do anything for me. I could do it myself. So it was like being in the hospital, but I wasn't. I was here in my own home.
This model of care is truly patient-centered. The patients are just so grateful. We've heard over and over again how excited they are that St. Luke's is now offering this program.
I feel like I'm actually giving great care. You can slow down and focus on the patient.
We are trying to really provide great experiences for our patients, be more efficient in the delivery of care, and treat patients where they want to be treated, which is typically at home.
Our model is patients that either were in the emergency room or admitted to the brick and mortar hospital who meet inpatient criteria will be transferred home, and then our team will have a community paramedicine person who will visit the patient in their home twice a day. Simultaneously, our registered nurses will be in our command center and they will be videoing in while the paramedic's in the home, and we will deliver IV medicines, we'll draw labs, we'll do monitoring. Physicians will visit virtually once a day. We'll have specialty consults. We intend to deliver hospital level care while the patient's in the comfort of their home.
They were right there, and you didn't have to wait for a nurse or feel like you were bothering anybody. All I did was push a button or pick the phone up. That was it. It was just wonderful.
In the brick and mortar hospital, I would guess they have 20 or 30 minutes to spend with a patient. And when they do their in-home visits, they have 2 hours. So our nurse practitioners are going to really get to know the patients, really get to know their family, do a lot of education. A lot of the care will be virtually as far as the RNs and the doctors. Then we still do have fairly lengthy and fairly in-depth in-person visits with the patients.
The holistic care that we have with the nurse practitioners, the physicians, our hospitalists, I feel like it's easier to do in the home. You can see all those different pieces that we might not touch on if they're actually in the hospital.
It doesn't exclude a patient who may not have a computer or internet or the capability to interact digitally, because we bring the entire technical stack into the home.
I think it was the paramedics that brought it in and set it all up for me. I could be in my own home and still get the care I needed to get back into feeling better. Was such a blessing.
I could just remember her just, with her head down, kind of crying a little bit, and I'm so thankful. Thank you for so much you guys have done. And I think that was really a great moment for Margot.
The opportunity for us to be in their home and to see what are some of their social determinants of health, what are some of their barriers to getting their medicines or to following medical advice will really be a tremendous opportunity for us to impact kind of their overall trajectory of their chronic diseases.
The patient ends up in a better position to manage their illness when they leave the program. And I think that is really because of the oversight and the monitoring and the focused care that they're getting both from the physicians and the nurses.